Tell me about your teddy bear. What's their name and what kind of doctor stuff did they get done today?
His name is IDK, and he he did some blood pressure, temperature, and X-ray.
Most of us, the child life specialists here at Wonders and Worries, we actually all came from a hospital setting. So to become a child life specialist, you typically work in a pediatric hospital first, and then you kind of move on to a community setting. And so because we all trained in the hospital, we all have experience with teddy bear clinics with inpatient children. And so we actually wanted to bring it outpatient with our children here, who their parents are actually going through those procedures, so that they have a better understanding of why their parents are going to the clinic. Why is their parent going to the hospital? What are these procedures that we're teaching them about? Like, what does that experience actually look like?
A lot of the time the focus is on the patient, the adult, the parent, and the children are suffering, right? They're having academic issues, behavioral issues, and a lot of times they don't feel seen or heard. So this is a good opportunity to bring the family together, and it's all about the child.
A lot of poking and all of that, and my daughter is terrified of needles, and when she was seeing Waddles get pricked and prodded, she understood a little bit more.
His name is Waddles. At first I thought he was a duck, but he's a chicken. We checked his blood pressure, his temperature. We did an ear check, and then they scanned his body, and then we did lab work.
They're coming in and they're making up the scenario. So we didn't provide scenarios. The kids made up what was going on with their teddy bear, and we went from there. And all of us coming from a medical background were able to kind of just create a scenario on the fly to kind of help them progress through all of the stations.
My experience at the Teddy Bear Clinic was incredible. It was really great turnout, just seeing all the kids and parents come in, and I worked in the recovery section, and so there was some people doing physical therapy, and then some people just, kiddos just coloring and then doing spin art, and so the kids were very engaging, and it was just great to be a part of it.
No matter what the age the kid is, like, they do want to talk about these experiences. They do want to see what's going to happen. Like, what are we going to ask them? What is the surgeon going to tell them?
You know, when somebody goes through an illness like this, you don't really think you'll have support besides just your immediate family. You start thinking that kind of way. I'm like, no, we're fine. But honestly, every treatment that we've done, you've talked to my kids about it, and they feel a little bit more like at ease. We really appreciate all of y'all.
You're not afraid of cancer, right? That's right. Because we're going to beat it, right?
We're going to beat cancer.